Hello guys and welcome back to another Facebook Live. As you know, this month we are doing it's all on ultrasound for the next few weeks. So that is what we're going to be doing today. As you can see from the title, it's how can ultrasound scans help my treatment? And it's a great question. For those who don't know, my name is Sam. I'm the pain and performance expert here at Sheffield Sports Medicine. And like I said, this month's all about the ultrasound. So last week we spoke a little bit about ultrasound, introducing it, what it is. And for those of you who have missed that, it's really pretty simple. Basically, it's a sonogram. So what it does, it creates images using certain waves, and then we can actually see underneath things like skin and superficial things like that. So you can see muscle tear, you can see damage to joints, even some fractures to bones, such as in the hands and feet. Anything that's a bit deeper, though, it may be a lot harder to see, and it may require a different type of scan, maybe an MRI or PET. But that is basically what an ultrasound is. It's what women have when they are pregnant, and they need to see what the baby is looking like and how far you are, etc., etc. So that's basically what an ultrasound is. So today's question is, how can an ultrasound scan help my treatment? And it's a really good question because obviously here at Sheffield Sports Medicine we do ultrasound scans quite a lot. And usually the reason we do them is one, because people have specifically asked for them. And don't get me wrong, sometimes we will go for an assessment and say, look, you probably don't need it because this is what's causing A, B, and C. However, sometimes, yes, they are needed, especially if people are getting symptoms such as where there's been structural damage and it's kind of correlating with that, then we may need to do an ultrasound to have a look further into the damage. But ultimately, an ultrasound scan can help because it can diagnose things with solid concrete proof, because you can see what's going on, you have the evidence right in front of you, so therefore you can diagnose it knowing what's going on. Without that, obviously, I wouldn't say you're guessing, but you're kind of going on what you've learned and your experience rather than an image, if that makes sense. So that's why an ultrasound is great, because you can actually see what is going on. You can see the evidence right in front of you. So if someone's got problems in their quad, they've got a quad pain, okay, which is just the thigh here. If they've got pain there, you could ultrasound it and you might find some fluid. You might find a tear there, which would be indicative to, some sort of tear in the muscle, grade 1 to unlikely 3. But that's the point of an ultrasound scan, is that you can see what is going on, and that's how it can help you diagnose things. But not just diagnose things, but help you as you progress as well. Because don't get me wrong, you could come in, you could have this problem, we ultrasound it, we see that there's a tear there, we see there's a break there, we see there's fluid there, and then what we can do is start treatment. And every so often we might ultrasound it again to actually see how it is improving and if it's improving. Okay, and that's a really good way to actually track your progress, your healing progress, and your recovery progress. We're using ultrasound. So yeah, a great example would be, a muscle tear. We can have a look at it, see how bad the tear is, see where the fluid is, because ultimately it's the fluid that causes the pain. And then, give you some exercises, give you some treatment. A few weeks later, re-examine, get the ultrasound out again and see how well it's healing. If it's healed, if the fluid's gone, then we know we're going in the right direction. And that's specifically what ultrasound is used for in a lot of cases. So that is how ultrasound can help your treatment, because it can diagnose it and help you physically see your healing and your physical progress, due to hopefully the things that we have been giving you to do and the advice we've been giving you as well. So that's why ultrasound is so good. It can also, scan for anything that we're unsure about as well. You might find a bump or a lump, we can scan it. We can, if there's fluid there, if there's swelling, we can have a look at that, see where it's coming from, how much it is. Maybe look at breaks, bones, meniscal tears. You can do a lot with ultrasound. It's a very good tool, and we do use it a lot. And like I said, a lot of the time, if people have the right symptoms, then we will go straight to an ultrasound scan to make sure that it either is or isn't. Because if it isn't, then we have to take a different approach and look for another answer to why you're getting this problem. Okay, but if there is structure there, if there is structural damage there, then it's either because you've had a physical impact, fallen, you have gone into a tackle wrong, hit the ball wrong, whatever, and you have caused a physical structural injury. Or it's a structural problem that's occurred over time from wear, from overuse, from loading inefficiently. Okay, and it's also really good at distinguishing what's going on in terms of looking at if the acute injury caused this, or if it's more insidious over a long period of time. Okay, and that's why ultrasound is so good, and it's a very good tool, especially when looking at diagnosing and helping people and tracking progress with treatment. So that is it really, how an ultrasound scan can help you with your treatment. So if you are unsure, or you are in pain and nothing's changing it, maybe an ultrasound is for you to see what is going on, because the way I look at it is either going to be A or B. There's either going to be something there that we find, okay, or B, there isn't, in which case we need to have a look at other things. And figure out why you're having a problem there. Why is it loading this way? Why is it not working? Why are you getting fluid there? Okay, so it just basically either helps us get concrete evidence to a hypothesis, or find something else. So it's a very good tool to use, and especially within treatment. So I hope that has helped you guys understand a bit of how can ultrasound scan help you with treatment. If you want an ultrasound scan, please get in contact with us so that we can get that scan done for you as soon as possible and get you your diagnosis. Because like I said, it's either going to show something or it isn't, in which case there's going to be a different route. Like I said, some things it just can't show, really deep things, spinal, struggle with that, but break in the hands, feet, joint issues, fluid, muscle injuries, tendon problems, it will probably be able to scan most of them, as long as they're fairly superficial, such as the knee, patella, Achilles, etc. Okay, so I just want to say a big thank you guys for listening to me today. I hope you have understood what I've been talking about in terms of ultrasound scan, and I hope you now understand the question of how can ultrasound scan help your treatment, or whoever's treatment it is, because like I said, it's a great tool that can give us a lot of information and data to help us actually get to the cause of the problem and fix you and get you out of pain for good. So like I said, if you need anything, or if you need an ultrasound scan, please get in contact with us, as we'd love to help you out and get to the bottom of your problems. Thank you so much again for listening. Have a great day, enjoy your weekend, and I will see you all soon. Take care, bye bye.